Hello, everybody. This is Gary. Today is Tuesday, May 5th, 2020. It is 5:33 p.m. Eastern Standard Times in the United States in Rochester, New York. And this is just a quick update on my physical and mental health. Mentally, I'm doing okay. I don't feel particularly depressed, paranoid, delusional. Um, I don't feel paranoid. I don't think, well, to some extent, I always feel paranoid. But I don't really feel strongly that people are trying to follow me today or they're trying to spy on me or that my neighbors are laughing at me or plotting against me. Um, I'm pretty much doing okay. The nicer weather helps. It's sunny outside today. It's a little bit chilly, about 45 degrees outside, but it's been sunny all day, and I went out earlier for exercise, which I either do by walking or riding my bike. I don't like riding my bike in the cold. It's very, I don't know, annoying. So if I don't ride my bike, I'll go for a walk for about a mile or two and then come back. And I'm still social distancing. Every time I go out, I wear a face mask. I paid $30 for at I think it was Walmart for 50 masks. I've 50 face masks. I think that's a pretty steep price for just 50 face masks. There's $30 that I had to spend on that. Um, I've been able to get a good supply of hand sanitizer. That's becoming more available in supermarkets and drugstores after people were panic buying and hoarding things like toilet paper, hand sanitizer, bleach, and a lot of other things. But some things are starting to get easier to obtain, like face masks, hand sanitizers, cleaning products, bleach, that kind of thing. Um, Quick update on my physical health. I have an appointment on May 11th over the telephone with my gastroenterologist, the GI doctor. Um, I have difficulty swallowing food, so it gets stuck in my esophagus, not up here where I'm actually choking and it cuts off my oxygen, but down in the sternum of my chest, the food gets stuck there, and that's very disconcerting and annoying. And if I try to drink fluids to wash it all the way down, the fluid backs up and comes out of my mouth. It's not vomiting and it's not nausea. It's just that the food has the water that I'm drinking, trying to make the food go down, just comes right back up because it's blocking my esophagus. And it's very uncomfortable feeling. It happens a lot. And this is something I'm going to have to bring up with my gastroenterologist over the telephone, that sooner or later I'm going to have to go in for a procedure that involves sticking something down my throat, like an endoscopy, and then expanding my esophagus. I'm not sure what they call it. They call it expanding it or dilating it, which lasts for several months, so it makes it easier for me to swallow food without food getting stuck. Of course, part of the problem is I also don't chew my food well enough. And for right now, chewing my food better would be the best solution. But in the long term, I'm going to need to have something done to my esophagus, a procedure to make it so that I don't have the constriction in my esophagus that I have. And I also have reflux disease, acid reflux, and that irritates my esophagus. And also, I'm on 1,000 milligrams of Seroquel, and the problems and difficulty of me swallowing started when I got on Seroquel. So this has been going on a long time, several years. I actually did have the procedure done once when they stuck something down my throat and they dilated or expanded my esophagus, which is not permanent, it only lasts for several months, and it has to be done again. And this is long overdue for me because it's getting really annoying. I'm afraid to eat and drink normal foods because I'm afraid they're going to get stuck in my esophagus and then it's going to come back up and then I will start choking. Um, but so far that hasn't happened. So I will talk to my GI doctor about that over the phone and we're going to have to arrange something because I can't keep living like this. But my situation is pretty good right now. I have money to pay my bills. I have all my medications, and I do my work, which are consumer surveys online for extra money. It's not a lot of extra money, but it's some money. Um, it's certainly not a full time job. I write poetry and I make these videos. I go for walks. Whatever helps me deal with the coronavirus and my mental health and helps my physical health. I'm still chain smoking. which I'm not sure I'm going to be able to stop anytime soon. And also, smoking probably doesn't help my acid reflux, and it doesn't help my esophagus either. So, smoking may not cause those problems, but it certainly aggravates them. So, I don't know when I'm going to be able to quit smoking. Um, but like, comment, share, subscribe, press the notification bell so you know when I put out a new video. Because even if you're subscribed, unless you hit the notification bell, you may not know that I put out a new video. I don't ask for money to do these videos. If you want to help me out, just share my videos on social network sites and take care of each other and yourselves.